of them. What do you think?
Ma'am, their presentation was really good. It was, I mean, a lot of information was present in the presentation. Even though it was a bit tiresome, we got a bit cranky about the amount of material over there, but it had very, I mean, all the very strong points to prove their fact and their topic. It was a good presentation, but way lengthy.
Thank you. Anything else? Okay. So, and so we have one more presentation which deals with the patient-centered approach, right?
Yes, ma'am.
Who is the person responsible for this presentation?
I'm sure I will share the screen.
Yes, ma'am. I will share the screen.
Where's Vandana?
Yes, start please.
Yes, ma'am. Now in my group, there was friend, ma'am, me, Mohammed, and Kriyesh Baj. And ma'am, our topic is ma'am the patient-centered approaches and history-taking means. So ma'am, first I would like to explain ma'am the approaches of history-taking means how many approaches. Ma'am, there are two approaches in history-taking. The first one is the patient-centered approach, and the other one is the doctor-lead approach. And ma'am. Ma'am, if you talk about the doctor-patient relationship, so ma'am, the US psychiatrist George Engel, ma'am, was known for his pioneer work on doctor-patient relationship. And about he gave a model like a biopsychological model DSM, and ma'am, in that model he shared their opinion and said that the working of the body can affect mind and person. And in that biopsychological model, the three things: the biological, psychological, and sociological factors. Ma'am, they correlated effect. Like a biological age, gender, genetics, and ma'am, psychological action, etc. Psychological, ma'am, their mental health, emotional health,
We've lost him. Yes.
Ma'am, is network too.
Well, the other students from the same group, do you have this presentation? I mean, you, yes, you can share and.
Can you see ma'am, can you see my screen?
Yes.
Vanna, you wanna continue or should I?
Yes, please.
Yeah, I can continue. Go to the seconds. Yeah. Shweb is here. Shweb is back. Okay.
Yeah. I got it. Sorry. So, ma'am, if you talk about ma'am, is that she present that the patient present to a doctor, and in that particular thing, is asking about the requires it requires a series of questions. Now, for that questions, ma'am, we have two models, ma'am, or many models like SPECS model, and in that picture, ma'am, we have a old graph model, and in that old graph model, the doctor asks about the onset, ma'am, like if the patient is complaining about pain, so ma'am, doctor asks about when did the pain.
Is he here or you want to?
His network is bad.
His network, yeah. What is text?
Can we wait for 2 minutes? Or should we continue? He's back. Okay. Should
Hello,
keep your
hello.
camera off. Keep your camera
Abhishek,
off. It might help.
Yeah,
Keep your camera off.
yeah.
Okay.
Mishan, the screen.
Okay. So, ma'am, in the old card, ma'am, in
Ah.
Well, the other students, maybe you can just continue.
Okay, ma'am. Okay, I will continue with this.
Mhm.
And basically, there are these models include like biological, psychological, and sociological models. Page slide. Go to 4th slide.
I was on the 4th slide. Man.
No, it is not.
It is
Yeah,
biofilm.
okay.
Slide.
Yeah. Now it is.
Yeah.
So basically, according to these models, biological aspects, they include the age of the patient, their gender, their genetic modeling, or is there any genetic defect or genetic diseases, and any psychological reactions due to the genetic issues or tissue health of their body. Then there is psychological aspects, which includes the mental health, emotional health, beliefs, expectations. Like it is very important if the patient is having some kind of psychological disorders or some traumas to handle with. And then again, the most important, or we can say the we face in every day, like sociological effect, sociological aspects, like how the relationship of the person is with their colleagues, with their parents, with their friends, with their people in the surrounding, basically. So next slide, please. Okay, he's also lost. Ma'am, I will share my. I
Okay.
will share my. That will be better.
see my screen.
We see something, but whose screen is it? Is we don't
Ma'am,
know.
it's my screen, ma'am. Mohammed
I
Shafeeq.
see. Okay.
Yeah, I don't know what screen it is.
Mhm.
Yeah, it is yours. Okay.
I will continue. I will give it. I will continue.
Okay, try.
Ma'am, if we talk about history taking, so ma'am, we have two, ma'am, many models like you, ma'am, in our previous class, you told about Socrates model, and ma'am, the other one is the old craft model. So ma'am, if we talk about the old craft model, ma'am, O stand for ma'am on-site. So the doctor asked about their symptoms or the ma'am like pain, ma'am, when did the pain begins? And ma'am, L stand for location, where did the pain begins? And D stand for duration. Ma'am, how long does the pain last, or it is constant or intermediate? And ma'am, C stand for character. Ma'am, the characteristics of the pain, it is sharp, shooting, or something like burning, etc. And ma'am, if we talk about A stand for aggravating factor to activities like ma'am moving, walking, sitting, etc. And ma'am, R stand for relieving factor, what medical and non-medical intervention relieve the pain. And ma'am, T stand for treatment. And ma'am, this is the final question. This is the final question. Every doctor asks about that one treatment. What treatment has the patient tried, ma'am? Is there any home remedies or something else? And ma'am, if we talk about the more questions, so ma'am, the question is basically divided into two types: so the open question and the closed question. So if we talk about the open question, ma'am, they are like what, where, and why types. Ma'am, they allow patients to express themselves in their own words. Ma'am, like what is your problem, and why are you here?
Can you hear
why
me?
you visit hospital, like something. And if you talk about ma'am close question, ma'am, it required only yes or no. Ma'am, it do not allow patients to express themselves in a ma'am in their own word. Ma'am, they are something like yes or no, that like you take any home remedy, so the patient replied yes or no. Now ma'am, I like to call my friend Vandana to continue.
Thank you, Shobh. Ma'am, now I will be telling what kind of questions a doctor should avoid in this kind of interaction. So first is multiple questions. Like a doctor should not keep asking multiple questions. In short, like he should give some time to the patient to answer, to think. He should not continue just asking the question on his own. So second is leading questions. Leading questions are like giving giving the patient the point or the thought to express himself with the point of view of the doctor. Like if he says, for example, we can take, if the doctor says, did you are you avoiding your medicines, or kind of question, so the patient is abide to say yes or no whatever he is doing. So these kind of questions should be avoided. And the second is tag questions. Basically tag questions, it usually it guides to a particular direction of the patient. Like if we say, isn't it cold, is it, so it helps. Like one part of the question is positive and the other is negative, to understand the question very well. uh, but for the patient it becomes confusing. The patient thinks, like is it really what I'm having, or is it really what I'm feeling? So these kind of questions we should avoid. And then again, like we can see the example is already given. The example can be seen, like you are not sleeping too well, are you? So the patient will be thinking, maybe I'm not sleeping too well, so this is the reason I'm having these kind of symptoms or this kind of problems. So these kind of questions which a doctor should be avoiding while asking a patient about his history. Next slide, please.
Can you hear me, Vandana?
Yeah, Priyesh, we can hear you.
Yes.
Thank
Let
you.
me finish this, okay? So effective question technique, like cone technique. This is a technique from which a question type moves from open to closed question. Like my friend already expressed, the open question means the patient have a long range to answer. Like he can use his own various ways to answer. But in closed question technique, there is only yes or no, or a very limited set of options to answer. Like if the patient if the doctor asks, are you feeling cold, he will be saying yes. So this is the kind of closed question. So if he asks what kind of pain you are having, so he will be like, sometimes burning, sometimes it's piercing. So this kind of question is open type question. So now I would like to ask my friend Priyesh to conclude this overall question.
So, ma'am, I think I'm facing few network issues, but I'll still continue with the topic. Ma'am, basically we are talking about the interaction a patient and a doctor can have. I mean the interaction between a patient and a doctor. So whenever we are talking about an interaction, it is basically communication between two people. And those two people, please go to the first slide. Don't change it. The communication is between two people, and those two people present over here are a doctor and a patient. So most of the points which are covered by my friend Shoaib and Vandana were basically contrasting on their focuses and their approaches. Now I'll be concluding the stuff for the basic approach we follow, because if two people are talking, one will be submissive and another will be dominant. So we are talking about the two different approaches, which is a patient-centered approach or a doctor-centered approach. We can also use a patient-led or doctor-led approach. First of all, we'll be talking about doctor-led approach. So whenever we're talking about a doctor-led approach, what happens here is that patient here lies in the dominant phase here, and he's to be stagnant on a vocal level and on a contactual level. So what happens here is a doctor is the one who is speaking or who's taking the charge. So chances here are that a patient has a very limited participation. So whenever if there is an issue, there are chances that he may lag and not actually express what is the particular issue, what is the particular cause. And the main central conclusion only depends upon the experience of doctor and his knowledge, that how he is understanding the stuff, how he's taking care, how he's taking out the conclusions out of patient. Because patient here is somewhat numb. He's not participating into the stuff, and that's why he's facing issues. And it's totally dependent upon the doctor. The doctor asks question, the patient answers. If he asks are you eating, he will say yes or no. He won't say yes, I eat, but sometimes I don't feel like eating. So this isn't the approach we're talking about. This will lag over here, and then chances are that the
treatment which the patient is going through will lag in this process. Now we are talking about the patient-centered approach. Can you please change the slide? So ma'am, patient-centered approach is approach in which patient equally participates, or he may act dominant on the doctor. So in this case, the patient is actually known to his issues, to his illness, to every current scenario which is going through, and he actively participates in the conversation as well as the treatment. He puts in his effort. If a doctor is asking that, are you feeling pain here? He'll say, yes, I'm feeling pain. But he'll also tell that when I do feel this pain. So he says, for example, he has a lower back pain, and doctor asks how often you feel it. He'll say that, yeah, I feel it very often, but then he'll conclude that whenever I do some workout or whenever I ride bike, I feel this back pain in my, I feel severe back pain. So he's actually excluding the question and putting in his assertions and his basic pro forma about the topic, and he's actively participating. That's why this form of approach can actually be more efficient, and it will help both the doctor as well as patient in his treatment and doctor in his understanding and ease of his work. Thank you, ma'am.
Okay.
Thank you, ma'am.
Okay, thank you.
Thank you so much, ma'am.
Very impressive. Thanks. Okay.
Thank you.
Can I ask somebody to comment on the last presentation?
The presentation was really nice. They presented it very well, but somewhere I felt the flow was confusing in the middle. Maybe because of network issues, it was overlapping, or I'm not sure about that. But yeah, that part, 3-4 slides, it was kind of working. But rest all was very nice. Good presentation.
Yeah, due to network issue. Yeah, we agree. We too agree, ma'am. Due to network
Yeah.
issues, we lost the flow in the beginning.
Yes. Mhm.
So sorry for
And what kind of a recommendation can you give to the speakers? Sorry?
Recording in
Keep doing
progress.
the good work.
No, ma'am, I was joining from my laptop. I got disconnected. No network issue. Now I'm connected again.
So, mhm. Okay. Now let us stop this mode and yes, Aman. What do you say?
Ma'am, it was regarding the Wi-Fi data farm connection, nothing else.
I see. You know better about this. Okay, and so as for my recommendations and my opinion about the presentation, I like them all so much that you've done such a big research about the information and
Thank you.
about the topics, and well, as for recommendations, I would recommend while presenting information, you should think about the audience too. I mean that so the other people are listening to you, and so the visual information on some slides was hard to read. So it was too small because of the font size, and maybe because of the mode, like you should enlarge the letters, or you should just divide the slides into, for example, one slide when there is too much information, too much text, into several slides, so it can be easy to understand. And so on some of the slides, I'm not speaking about exactly this, the last presentation, about all of them. On some of the slides, there were too much text. I mean, very hard to understand, and that is why sometimes we feel lost what the speakers were telling us about, okay? And there was some, I didn't understand, there was some report. You were speaking about report, right? So I don't remember who was speaking about this in the second presentation. So there was a
Ritik was speaking.
okay. And so also my recommendation is I see this is the fourth, this is not the first presentation about these topics, because I've heard this information from the other groups of students, and I see the same information is given because you've used the same resources and the same graphs, yes, and the same terms, and it makes sense to give the reference of the resources to the resources which you've used during which you've used in your presentation. So you should just make the list of reference, for example, on the last slide, so we can see. And if we are interested, and we can just use these books or journals to read the information in details. So thank you so much. It was great to listen to you, and so I like it too very much. Well, and let us continue with our studies. I mean, what I planned for this class. Well, and today we with clinical practice, and let us focus on, yes, let us focus on the slide which is given here. On this slide, you can see several pictures that illustrate different jobs involved in medical treatment. And I would like you to guess the jobs which are shown here. Do you see?
Okay, ma'am.
Ma'am, may I?
Mhm.
First, in the first picture, we can see a lady working on a computer. I think she works in a laboratory, lab work. The
Ma'am, she
second
is
is,
May I?
receptionist.
Yes, if you pay attention to the shelves filled with the
Receptionist.
this papers.
No,
Yes.
fine.
Mhm. Okay. What about the other pictures?
Second one is a doctor, physician,
third one looks like a nurse,
and the third one is having a
pediatric.
jerky. So I think he's a surgeon. He works in OT.
Surgeon, maybe. Yes.
Okay. So, and if we speak about picture B, what is the place? Where are the people here in the picture?
Hospital.
It looks like a home. It looks like
Hospital.
No,
home
it is
visit,
not.
I
It's
But it
looks
is a
like
home.
a home or a
Therapy, I
yes.
think.
It's like home. Okay.
Yeah.
So
Home
actually,
appointment.
we were right about the receptionist, and in picture B, the person here is a health visitor, health visitor who just visits the people, elderly people, for example, who can't leave their house. And so general practitioner GP is in picture C, and we can call this woman in picture D a midwife. Yes, it's a kind of nurse. Midwife, yeah. And so if we move to the next slide, we can see three more puzzles here, or just try to guess their jobs.
Maybe porter, E-diagram. Maybe because she's sitting in
Ma'am,
a
she's a paramedic, ma'am. First one is
maybe a paramedic or a
Yes, ma'am. It's paramedic.
I see. Okay.
Second one is a professor.
Mhm.
Third one is a general practitioner.
Ma'am, she is a pediatrician. Pediatrician. Ma'am, third one is pediatrician.
Cardiologist.
Pediatrician.
Okay, yes, possible, of course. Well, what we mean, I mean here, the three jobs. So district nurse, just then practice manager. Practice manager is the person who helps to organize the whole process in clinic. And here, this is practice nurse. Okay. And I would like you to think, what do you think is the most stressful aspect of medical work?
Ma'am, surgeons,
I mean, why is it stressful?
surgery. Because there is hours and hours of surgery ongoing. Like sometimes we
Continuous.
one day,
No,
2
ma'am.
days.
The most
Ma'am,
tiresome is
continuous long
reception.
surgery, like now some surgeries are having ma'am full days. Ma'am, it takes
24 hours, 30 hours.
Full aspect of
30
Heart
hours.
medical.
So, ma'am, it's very stressful.
I have different opinion about this stuff.
Yes, even I have a different.
Physical and mental stress, like there are two
Yes.
different stressful situations we can say. Physical stress comes with the amount of hours the nurse or the doctor works,
It is
but the emotional or the mental stress comes with the what we say, the responsibility, the load of the work we are doing.
when we talk about the responsibility, the most stressful aspect of medical work is the life or death of the patient. It is the most stressful part of the surgeon or any doctor. And the most rewarding is when that patient has recovered.
One wrong move and it's a matter of life and death. That's the most stressful.
And most rewarding is that the doctor has given a new life to the patient,
Okay.
new hope of life.
Mhm. Great, good, thank you. So, and so if we just keep in mind the names of jobs from the previous slides. So here we need to add the job titles to the sentences. Just let us just work in turns like we usually do. And Aman, will you read the first sentence?
A practice a practice is run by a practitioner.
The general practitioner or who?
General practitioner.
General practitioner. So if we speak about running the company, running the whole hospital, it can be also practice manager, right? Okay, so Apeksha, what about the second one?
The second one can be the nurse as well as the general practitioner, because the nurse, after the like a baby is delivered, after the doctor's part is done, the nurse has its role playing on by taking care of the baby, checking on the patient's pulses and other vitals is the part of the nurse. So I guess the work with the individuals, families and groups goes with the nurse.
Okay, and so if we would go back to the previous slides, we have just health visitor, midwife, or district nurse, or practice nurse. What kind of nurse is here? Which
Practice
nurse?
nurse.
Practice nurse.
Along with the district nurse, both of them can go, because home visits can also be considered in this part.
And if we speak about
Communities.
Dealing with elderly people and newborn babies, so they normally stay at home, they do not move to any places, and this
It is very difficult for the elderly people to travel.
I mean,
so
yes, but what's the name of the job that we were speaking about? This is health visitor, right? So it's
Yes,
better
health
to
Visitor.
Geriatrics, ma'am. For elderly people, it's geriatrics.
Mhm.
Geriatrics.
Yes, this is a special kind of specialist. Okay. Now, in number 3, Misha, please.
Is a receptionist need a very good interpersonal skill because they are the first one to contact the people, have with the practice.
Okay,
Because the
great.
first time we enter a hospital, we first visit the reception.
Okay.
Then they guide us where to go.
The next is for Nivas. Ram Nivas. Is he here?
No, ma'am.
No. Then Nishat, Vandana,
Yes, ma'am.
Acharal. So Vandana. Mhm.
Ma'am,
Yes, number 4, please.
fourth one, right? 97% of the UK population registered with the
So you need to have a registration. So
With a doctor.
With a doctor who, what kind of doctor?
health practitioner, we can say.
Is it like
midwife?
General practitioner.
general practitioner? Okay. Mhm. Well, then Priyesh, the next sentence, please.
The duties of a traditional nursing skills and running specialist clinics for. Ma'am, this is a general practitioner as well. He has basic nursing skills and runs a specialist clinic for immunization, diabetes, and so on.
But this is nursing skills. So,
Ma'am, we general practitioner as well as nurse. I mean the midwife over here.
okay, diabetes immunization. I think it's better to say practice nurse because this is a nursing skill, and so he does all the practical treatment so for the patients. So this is practice nurse. The next is for Rakhav.
He's not here, ma'am.
I see.
This is not.
Then Ujval. Ujval.
Yes, ma'am.
So please sentence
Yes, ma'am.
sentence 6. Mhm.
Number
6.
an important link between the hospital, GPs, and the other health professionals involved in antenatal care is the, ma'am, I think it is the general practitioner or the practice nurse, because they make a link between the health professionals.
So do we
work
understand
together.
antenatal care?
Ma'am, I think it is midwife.
Midwife, yes. So
Ma'am, because it gives information about ma'am, knowledge about ma'am the newborn infants and their families.
Natal is
And ma'am, take
newborn.
care of ma'am,
yes, right.
both the
Okay.
family, baby and
Mhm. Thank you. Well, the next is for Sayonika. The last sentence, please.
Visit those who are houseborn or those recently discharged from the hospital and address wounds, health visitors.
Yes.
So this is what did you say? I missed it.
Health visitors, ma'am. She said.
Yes, it can be district nurse or it can be health visitor. Mhm.
health visitors.
Health visitor. Okay, so we have only 2 minutes left. So I think it makes sense to take a break, and so in 10 minutes we'll continue, right? Okay, see you in 10 minutes.